Joining us now, co-host of MSNBC's The Weeknight and former RNC chairman Michael Steele. So Johnson says no votes this week, keeping the House home for a third week straight. What does that signal? Does it signal that the Democrats aren't serious? Does it signal that the Republicans aren't serious? Does it signal nothing?
No, it's in my estimation, it signals that the Republicans aren't serious. And it's for one basic fundamental reason. It's nothing to do with partisanship or anything like that. You run the damn House. You're the ones who sent the members home early in August because you didn't want to deal with the Epstein situation. Then when they came back, you sent them home again right before the shutdown deadline. And now you're saying that, oh, I'm sorry, unless you give me everything that was in the package before, knowing that what was in the package before undoes or just just breaks apart the whole healthcare construct for the American people, and you don't want to negotiate on that. Yeah, I mean, you control that argument. You control the narrative there. So the Democrats were in Washington last week, have been in Washington. They were locked out of the Capitol. And so Speaker goes on our network and other networks, and he says, oh, poor me, I don't know what else to do. I've done everything I can. No, you haven't. Bring your members back, number one. Number two, sit the new member from Arizona. And you know why that? She won't be seated because she's the 218th vote to open up the Epstein files, which MAGA wants, which MAGA Republicans want, which Congressman Massey wants. So this whole sort of, oh my God, I have no control over any of this, the Democrats are the bad actors here, is just a lot of baloney because you're the Speaker, you control the schedule, you control whether the doors to the House are locked or open. And if you want to negotiate, bring everybody back and sit in the room and negotiate.
Let's talk about what they're what Democrats think they need to negotiate on. This is health care. They say that they want to extend the Affordable Care Act, the Obamacare subsidy, which is going to run out at the end of the year. By the way, it's not like they can wait till the end of the year because people are going into open enrollment starting next month, and they're going to be choosing their health care plan, and they've got a budget. You know, this is not something that you can be willy-nilly about. You've got to budget your life. You got to budget for health care. It is expensive, and it stands to be 3 times as expensive. Republicans say they have time to do it. They also say that on top of that, the Democrats are asking for health care for undocumented immigrants. The Democrats are calling that baloney, saying it's actually just the money that you pay back hospitals and ER centers when they take care of somebody who is in urgent need, who might not have documentation. It's a payback for a hospital. It's not an active health care plan for undocumented immigrants. Who's in the right here,
Well, the Republicans are lying. Let's cut through it. Cut through it. Republicans are lying about this. The provision of the law that they're talking about dates back to the Bush administration, number one. Number two, federal law does not allow you to spend federal dollars on illegal immigrants, period. That's why the Bush administration put that piece in there to say, well, if you are here, and it's not just illegal immigrants, by the way, it's anyone who comes to our country who has a medical emergency, right? And they have to be treated. This permits the hospitals to treat them. You want people dying outside your emergency rooms from Europe and Africa and Asia because you won't let them in? No, that's not supposedly who we are.
But also, hospitals aren't taking. Are they in the practice of taking immigration paperwork when they're admitting somebody in the emergency room?
No, of course not. They're not looking at your immigration status when you're bleeding out, for God's sake. They're trying to save your damn life. And to have Republicans sitting up here talking about, oh, we want to take that money out, that we can't spend, that spending for illegal immigrations or illegal immigrants is again, more baloney. And the fact of the matter is, to your first point, the way this bill is structured, it pulls those subsidies away. So people are looking at 100, 200, 300, 400% plus increases in their health care. People who can't afford it. Oh, and by the way, these are largely people in those very self-same red states that Mike Johnson represents and a lot of the members of that caucus represent. So they have to go back and explain to their folks why all of a sudden their premiums are going up, and they're looking to put the blame on the Democrats who are trying to say, no, Save the subsidies so poor
So
people
why
don't have
aren't
to
they
pay more.
extending the subsidies if it's going to affect their voters? What's the
Because you
strategy?
gotta pay for the tax cuts. How do you pay for the tax cuts? Social Security, Medicare, Medicaid, health care, the safety net. That's the only thing left. You increase the Defense Department budget to $1 trillion. Where does that money come from? And so, look, this is not a complicated math project. Money in, money out. The money in comes from who? The American people, right? And what they want to do is the money that's coming in is largely off the backs of middle class and poor Americans, the way our current tax structure is set up. And I say this as someone who's been inside the look, you know where I was on Obamacare back in 2009 and 2010. But it is now a part of the American healthcare system. You cannot just willy-nilly extract it and think you're not going to harm up to 27 million Americans. And then you're layering in this immigration nonsense. It's crazy. So the reality of it is you cut taxes, you got to pay for them. And where you're paying for them right now matters. And it's seemingly coming off the backs of poor people.
It is a gamble for the party to hope that ultimately the promise of a tax cut, and regardless of where the tax cut goes, will outweigh the reality of higher health care premiums. It's a gamble. All right, Michael Steele.
It's not a gamble for middle class because the middle class won't see those tax cuts. The tax cuts were not geared towards the middle class.
It's a gamble for the Republican Party to think that they're going to be able to.
Clarification.
Yeah, that's
good point.
If they could sell it off this. Anyway, Michael Steele, always wonderful to have you. I love asking you simple questions because I get the best answers. Michael, good to have you. You can catch more of him on the weeknight tonight at 7 p.m. Eastern right here on MSNBC.